All right, everyone, we are going to go ahead and get started today. Thank you all for joining us for the February Buckeye Wellness Lunch and Learn. We have a couple of great upcoming events. Our next Lunch and Learn for March will be also on the 26th. It is going to focus on nutrition to go along with National Nutrition Month. We have Movement and Mindfulness Mondays continuing. They are every Monday at 11:50 to noon. It's a great 10-minute break for you to get in a mindfulness session or do some movement and some stretches, and they're all streamed out through our social media channels. For those of you that are familiar with the Stay Calm and Well webinar series, we are coming back with a part 4 that is starting on March 17th, and it will be Wednesdays from 12:30 to 1. And we are continuing our virtual fitness classes. We have offerings from Monday through Friday, and you can find them on Link to Health in the YP4H calendar. We have 3 wonderful presenters today. So if you have any questions, put them in the chat box, and once we get through all the presentations, we'll go and do some questions. Our first presenter today is Dr. John Larry. Dr. Larry is an assistant professor of clinical medicine in the Division of Cardiovascular Medicine and the section chief for the OSU East Cardiovascular Medicine. He also has been a faculty member in cardiology for the past 24 years. Dr. Larry is interested in cardiovascular prevention and risk reduction, as well as general cardiology. Dr. Larry, I will hand it over to you.
Can you see my screen at this point, Nicole, or?
Not yet. Make sure you, at the bottom of your screen, you click share screen and then select your presentation in there.
How about now?
That's perfect.
Oh, great. Okay. Thanks everyone for taking time out of your lunch to meet with us. Difficult year, certainly for everyone. And this used to be kind of a humorous slide we used to use in these talks. And now I look at it and think this is kind of what COVID's done to all of us. We sit at home a lot. We don't get out. We don't exercise like we should. Our dietary habits have suffered. Our weight may have gone up, and a lot of people we've seen in the office have increased weight this past year. And all this can have consequences on our long-term cardiovascular health, which we'll talk about. So hopefully this will be a motivating hour of interaction to kind of encourage people to try and reverse some of the things that have occurred as a consequence of the COVID pandemic and all the isolation and inability to be active and focusing on our cardiovascular health. So just to set the stage, with all the focus on COVID, not too much in the media these days about heart disease. And there's sort of that myth that, well, heart disease is not so much of a serious threat, but keep in mind, every 36 seconds, somebody in the US dies of a heart disease event. 800,000 heart attacks in the US each year. We have 100 million people with high blood pressure in our population, 30 million with some type of cardiovascular disease, be it coronary disease, valvular disease, electrical system disease, or heart muscle disease, congestive heart failure. And unfortunately, the reality about heart disease is 1 in 5 deaths actually occur before age 65. So prior to the opportunity to enjoy your retirement. So that's really the huge concern. And so keep in mind, lengths of stay for a heart attack have gotten very short. And many people know a family member or a neighbor or a friend that's been in the hospital with a heart attack. And unfortunately, people are out of the hospital these days in a couple days. So a very short hospital stay. And it's kind of like, well, that wasn't that big a deal. I feel fine. I'm going to be okay. And the reality is, after a heart attack over the next 6 years, a significant percentage of men and women will have a second heart attack. maybe 4 out of 10 males and a third of females will have chest discomfort with activity, what we call angina. About 20% will have consequential congestive heart failure. 10 to 20% of people will have a stroke in that period of time. And a small percentage, but higher than we would like to see, can die suddenly related to an electrical consequence from the heart attack. So really underscoring the importance of very aggressive prevention and certainly involvement in cardiac rehabilitation. So as everyone knows, the heart's job is to pump blood and circulate blood throughout the body. Obviously, the heart's divided into varying chambers, and the right side of the heart pumping blood to the lungs, the left side of the heart getting that oxygenated blood and pumping blood through the aorta to all the organs and tissues throughout the body. The heart obviously has muscle, valves to govern the direction of flow, an electrical system to really respond at times of activity, so your heart rate increases and slows down at times of rest. And certainly you can have diseases of really any of these areas. So you can have valve disease, you can have heart muscle disease, you can have disease of the valves, you can have disease of the electrical system. But really, the most common cardiovascular disease and the one we can prevent the most readily with current strategies are disease of the coronary arteries, these blood vessels that run on the surface of the heart and deliver oxygen and nutrients to the heart muscle cells. Now, if you look at a cartoon here of a cross-section of a coronary artery, this is what a normal blood vessel should look like. It has a little bit of muscle cell and then this lining of what we call endothelial cells that separate the blood pool from the wall of the blood vessel. Certainly as we age, and even at young ages, like in our teens or preteen years, a small amount of cholesterol begins to build up in the wall of the blood vessel. Over years, particularly if our lifestyle is not good or we have other genetic predispositions, that amount of cholesterol in the blood vessel wall continues to build up and expand. But really the thing that triggers a heart attack is disruption of this lining, this endothelial lining, that triggers blood clot formation. And then abruptly a blood clot can block off this artery and interrupt blood flow to a section of heart muscle, causing a heart attack. So this is why people can be asymptomatic and absolutely doing just fine one day and the next day be in the emergency room with an acute heart attack. It turns out about half of the deaths from cardiovascular disease are related to disease in the coronaries. So really important to focus on those aspects from a preventive point of view. Now, certainly just review some of the symptoms to be aware of. Chest discomfort can be a symptom of heart disease, can be many other things as well, but certainly not something to take lightly. Exertionally provoked shortness of breath, inability to lie flat due to shortness of breath. If you're waking up at nighttime gasping for wind, any swelling in the ankles or feet, palpitations or fluttering, or perceived rapid heartbeat, lightheadedness or loss of consciousness, or decrease in pre-existing exercise tolerance. Any of those symptoms could be some form of heart disease and are certainly worth discussing with your physician. Certainly the important signs of a heart attack to be aware of. Most heart attacks typically present with chest discomfort. It may not be pain, it may be a pressure, a squeezing, a fullness, an ache. Sometimes it's not chest discomfort at all. It may be discomfort in one or both arms. It may be in the upper back or in the scapular region. It may be in the neck, jaw, or in the epigastric or upper stomach region. May present with abrupt onset of shortness of breath. Sometimes these are associated with cold sweat, nausea, or lightheadedness. And keep in mind that females are more likely to have heart attacks with what we consider atypical symptoms, or not necessarily chest discomfort, but may have more likely pain in the neck, jaw, throat, shoulder, upper abdomen, or upper back. So the bottom line, any unusual symptoms between the jaw and your belly button could reflect a heart attack and certainly warrant investigation, prompt presentation to the emergency department, calling 911, and not to delay. There are other life-threatening causes of chest pain beyond coronary disease and heart attack. pulmonary embolic disease, which are blood clots going to the lung, a dissecting aortic aneurysm, which is a tear in the aorta, the large blood vessel that comes out of the heart, inflammation of the lining around the heart, the pericardium, what we call pericarditis, that sometimes can develop enough fluid that it impacts the heart's ability to fill and can become a life-threatening situation. A collapsed lung sometimes can occur and have enough pressure inside the chest cavity to affect blood flow. And certainly rupture of the esophagus is a very unusual, but can be a serious cause of chest pain. So again, if you're concerned and having unusual symptoms, please don't delay, call 911. Don't drive yourself to the emergency room. Now, in terms of the preventive focus, there are certain risk factors we've learned over years for the development of coronary disease. Certainly, as we all get older, the likelihood of coronary narrowing increases. Certainly, males are more likely at any given age. Excuse me, go back one. Males are more likely at any given age than females to have coronary disease. And certainly, family history is important. We're learning more and more about genetics, but our genetic knowledge is very minimal in regards to vascular disease these days. But again, if you have a first-degree relative that had a heart attack or coronary disease at a young age, that puts you in a higher risk category. Again, as we all get older, you can see the prevalence of coronary disease continues to increase. And certainly at any age group, males more common than females, although over the last couple decades, prevalence in females has been increasing. Again, a significant family history would be considered a first-degree male relative who developed coronary disease less than age 55, or a first-degree female relative with coronary disease less than age 65. First-degree relative would be parents or siblings. Can't do much about your parents, can't do much about getting older, and certainly those risks are inherent, but there are things that we can do things about in regards to either preventing or modifying certain pre-existing conditions. And those risks include diabetes, cigarette smoking, high blood pressure, what we call hypertension, abnormalities in cholesterol with hyperlipidemia, obesity, or sedentary lifestyle. And all these are things we can have some impact with our behaviors. As far as diabetes goes, diabetes can be divided into type 1 or type 2 diabetes. Type 1 is probably a genetic and inflammatory condition related to the absence of production of insulin. But more commonly, people exhibit type 2 diabetes, where the body's production of insulin and its effect on tissues becomes impaired related to obesity. And people with diabetes, it turns out, have the same risk of a heart attack as somebody who's already shown evidence of coronary disease. So certainly, if you have diabetes, you really need to aggressively address all the cardiovascular risks to prevent a coronary event. Oops, sorry. Certainly, cigarette smoking has been shown to almost double your risk of a heart attack compared to a non-smoker, and certainly also increases risk of stroke, lung diseases like emphysema, and numerous cancers. I certainly encourage people to not give up when it comes to smoking cessation. Cessation of smoking can really reduce your cardiovascular risk and certainly decrease your risk of lung disease and numerous cancers. It may take multiple efforts to reduce or to be successful at quitting smoking. Beyond behavioral modification programs, there are certain medications that can be helpful, including nicotine replacement, Zyban, or Chantix. High blood pressure, very prevalent. As I mentioned, 100 million individuals in our country with high blood pressure. Ideal blood pressure would be 120 over 80 or less, but we accept anything below 130 over 85 as normal. A blood pressure repeatedly above 140 over 90 is considered high blood pressure. To treat this requires lifestyle modification and medication strategies. And it turns out many people need multiple blood pressure medicines to bring their blood pressure back to normal. The important aspect is that treatment reduces your risk of heart attack by about 14% and your risk of stroke by 42%. So very important, if you have high blood pressure, to be compliant with lifestyle, medication strategies, and periodic follow-up. And this really just depicts kind of how blood pressure evolves as we get older. Um, Small numbers of individuals in their 20s and 30s have high blood pressure. By the time we get to above age 65, somewhere between 2/3 and 3/4 of the population in those age groups have high blood pressure. The challenge is high blood pressure is an asymptomatic disease. You have no symptoms for the most part. Some people will say they can tell by a headache, and some do. Some people don't feel right when their blood pressure is elevated, but by and large, people do not have symptoms related to high blood pressure. So unless you get your blood pressure checked, the awareness of blood pressure is certainly less than 100%. And if you look at all comers, people that have adequately controlled blood pressure is somewhere about 25%. So out of those 100 million individuals, perhaps a quarter have adequately controlled blood pressure. So we certainly have a long way to go in regards to messaging individuals about the importance of this and being successful at controlling high blood pressure. We mentioned the importance of lipids. Lipids are fat particles that circulate in the bloodstream. Really two measurable categories of lipids that we measure when we do a blood test. Cholesterol is one, triglycerides is the other. Cholesterol we typically fraction into LDL or low density lipoprotein cholesterol. This is what people have sort of termed the bad cholesterol fraction. LDL cholesterol gets deposited in blood vessel walls and increases the risk of vascular disease. The HDL or high density lipoprotein cholesterol fraction is actually cholesterol that's being returned from the periphery of the body to the liver. And high levels of HDL cholesterol actually associated with reduced cardiovascular risk. The other fat particle in the bloodstream, triglycerides, is also associated with an increased risk of coronary disease. So if you have your blood test for cardiovascular risk, your doctor should measure all of these. These curves just show information correlating people's total cholesterol. So this is not breaking down into fractions, but just total cholesterol and incidence of coronary disease, as well as mortality. And certainly for those with higher cholesterol levels, both incidence of coronary disease and the likelihood of dying of a coronary event increase with higher cholesterol levels. What are the treatment options? Well, certainly diet, activity, and weight reduction are the hallmark, but there are numerous categories of medications. The most commonly used are statin therapy, but we have other agents such as Zetia, these relatively newer injectable PCSK9 inhibitors. There's a new agent now in the last year called bempedoic acid. Bile acid sequestrants are still used. And then for triglyceride issues, fish oil capsules and fenofibrate are considered. So a whole host of medications, and sometimes these need to be used in concert to achieve predetermined target levels of cholesterol and triglycerides. Obesity obviously is something that's really been a big public health challenge. Certainly, if you look over decades, prevalence of obesity over the last 50, 60 years has increased dramatically. And certainly beyond that, the prevalence of obesity in our teenage and preteens has gone up dramatically. And so now we're starting to see people in their late teens and 20s with type 2 diabetes, which we would never see before as a consequence of significant central obesity. So this is certainly a big public health issue we need to continue to work at and really educate young people about the importance of healthy dietary habits and regular physical activity, try and mitigate tendency toward obesity and weight gain. And really, it's central obesity that causes the consequence. So when people get excess fat in the intra-abdominal cavity, insulin tends not to respond as well in the periphery, and insulin levels increase, and this tends to elevate triglycerides, lower good cholesterol, increase the numbers of bad cholesterol particles, elevate blood sugar, and elevate blood pressure, all of which conspire to increase cardiovascular risk. So we really want to work on weight reduction. So at the end of the day, what can I do to try and reduce my chance of a cardiac event, a heart attack? We're going to hear more about heart healthy dietary habits, really want to encourage you to be physically active, strive to maintain or achieve a healthy body weight, avoidance of smoking or cessation of smoking if you are a current smoker. And then you really need to get seen by a healthcare professional so that you can get your blood pressure checked periodically, blood sugar measured, blood cholesterol measured. All these are silent conditions that occur and go on for many years undetected if you don't see your doctor and get these things measured, and again, lead to cardiovascular issues. Stress management may also have a role. And then for certain individuals, there may be some benefits from the prophylactic use of aspirin for primary prevention, but this really needs to be discussed with your doctor because aspirin does slightly increase risk of bleeding. So with that, I'll wrap up there and I'll have Nicole turn it over to our next speaker.
Yes, that was great. Thank you, Dr. Larry. As a reminder, everyone, you can put questions for him in the chat. We will get to them at the end. Our next presenter is Kris Dilley. She is a registered dietitian who has been working in the Comprehensive Weight Management Program at The Ohio State University Wexner Medical Center since August of 2018. She received her Bachelor's of Science in Allied Medical Professional Medical Dietetics program from The Ohio State University. Christine enjoys sharing innovative nutrition ideas with her patients to help them improve their overall nutritional status and their daily relationship with food. Kris, I'll let you take it away.
Great. Thank you, Nicole. And thank you, Dr. Larry, for that great information. Today, I'm going to talk about heart healthy nutrition with a focus on snacking. And some of the objectives of our discussion today will be to learn which foods to limit and which foods to consume more of to maintain a healthy cholesterol, triglyceride, and blood sugar levels. We'll also talk about which foods to limit and which foods to consume more of to maintain a healthy blood pressure. And then talk specifically about what kinds of foods and snacks will align with those goals. I chose to focus on snacks because I think that's a trouble area for a lot of people. Meals, sometimes it makes a little more sense. We think about, a protein and a vegetable and a starch, but sometimes when it comes to snacking, it doesn't seem like there are a whole lot of great options out there for us, or people just aren't sure what to put in place there. Okay. So what risk factors can a heart healthy diet improve? We've kind of talked about this already, but cholesterol, triglycerides, your blood sugar, or your A1C if you're monitoring that, and your blood pressure. Okay. So to improve cholesterol, one of the goals we have is to eat less of foods that are high in saturated fat. And saturated fat, an easy way to think about that is typically a fat that is solid at room temperature. And so kind of easy to think about that in terms of animal-based foods. Most sources of saturated fat do come from animals. We can see on the right there, cheeses, milk, if it's not a reduced fat level, butter, the meats all have red meat, but all meats will have some amount of saturated fat in them. And then as far as a plant-based, probably the most popular one that people are kind of using recently would be coconut oil, because that has kind of become popular, I guess, and some of the low carb type diets, it's used quite a bit. But I think a lot of people don't realize with it being plant-based that it does have saturated fat. And then a lot of the more processed dessert type foods, either dairy-based or grain-based. So think like, croissants possibly, or like the Danishes that you see, or even donuts or cookies and cakes that are available. Typically, these are things that are not refrigerated, and they can be very high in saturated fat. So we can see our goal over here on the left is not a lot in a day's intake. So ideally, you're going to have this be 10% or less maybe 7% or less of your dietary intake. So working to decrease the fat content of the animal foods you're consuming, moving to lower fat cheeses, lower fat milks, lean cuts of meat, and then a more sparing use of some of these fat products that have more saturated fats in them can all be helpful to reduce our overall intake of saturated fat. Okay. Now,
sorry to interrupt you. Is there a way to go into full screen? We can see your upcoming slide, small to the side. I don't know if there's a way in the system you're in to go full screen.
Gotcha.
If not, no big deal. Just
well, in good question, because it kind of looks like on one monitor it's in full screen and the other one it isn't. So I'm open to suggestions if anyone has them.
Under the display settings at the top, does that?
Yeah. Okay, gotcha.
Swap presenter.
Yeah. Okay, that work?
Yes.
That's
all right.
Perfect. Thank you. Sorry to interrupt.
Thank you for the assist. I'm sorry, I'm not super familiar with Zoom. I work mostly in Teams, so kind of a novice at this. Okay, so to improve cholesterol, what we would want to do is eat, of course, we just said eat less of the saturated fats. So then that's going to want us to eat more of the unsaturated fats. And an easy way to kind of think about this might be more plant-based types of fat sources. So now even these, as you can see on the right, may contain small amounts of saturated fat, but in much, much smaller quantities than what we saw on the last slide. So some good sources to increase our unsaturated fats would be olive oil or canola oil, even avocado oil. If that one has a nice mild flavor to it. So if olive oil is a little strong for your taste, avocado might be a nice substitution for that. Our actual avocados themselves, of course, are a great source of healthy fat. Nuts and seeds, tofu or olives, or even some of those fattier fish can be a great source of the healthy fats that we're trying to include more of in our diet. Okay. Now, the other thing we want to focus on eating more of is soluble fiber specifically, and fiber overall. So this goal here is for soluble fiber specifically, but the total goal we would want to shoot for in a day for total fiber intake would be at least 25 grams for women and 35 grams for men. So overall, most people do not reach the fiber goal daily. I would say in a standard American diet, probably only about 10% of people are regularly and consistently meeting that fiber goal daily. So we want to look to our diet to see where we can get more of it. And fiber is going to come from plant-based foods again. So meat does not have any carbohydrate, does not have any fiber. So that's not going to help us achieve that goal. So we're going to look towards foods like beans. There's a few specific examples here, but all beans as a category are going to be a good source of fiber for you. Vegetables, especially ones from the cruciferous family, but even starchy, non-starchy vegetables, those are all going to be good sources of fiber for us. Also fruits. We look at whole grains, so including things like oatmeal in our breakfast, and then other seeds also, and nuts can be a good source of fiber. So these are a few specific examples, but in general, if you think about increasing fiber, think of more plant-based foods in their whole form. So when we're looking at grains, you're going to want to get the ones that are not refined. So moving away from white flour products in breads and pastas and moving towards whole grain products can all help us increase our fiber intake daily. Okay. Now, when we're looking at triglycerides and your blood sugars, it goes along with what we've already talked about in wanting to eat less of those saturated fats. But there are some other foods that we would want to eat less of. In this example, we talk about refined grains, similar to what we were just talking about. And this would be foods like white rice, white bread, or pasta, or any other types of foods that would be made from a white flour. So this could also be things like pancakes and waffles. And I know that sounds like all the fun foods are going away, but there are alternate ways to make these foods in a way that's more healthy using less refined grains. We also would like to decrease our intake of added sugars. So obvious sources of added sugars would be things like cakes and cookies, sweetened beverages, many or most cereals, a lot of different granola bars or energy bars that are on the market, and many kinds of yogurt can also be high in sugar. Now, the good news is that there all are usually alternate versions of these that don't have as much added sugar, but you have to be careful in reading the nutrition labels to kind of sort those things out. I know for a lot of people with yogurt in particular, it can be tricky because there are just so many different varieties available that it can be really time consuming to find one that fits your goal and is low in added sugar. So you can see at the bottom, for added sugars, the goal is for men, 9 teaspoons or less per day, and for women, 6 teaspoons or less per day. This can be a difficult goal to achieve because even beyond these obvious sources of added sugars, there are many food products that have sugar added to them that people don't realize. For example, things like ketchup and barbecue sauce. A lot of the tomato-based sauces have sugars added to them. So this goes back to the idea of checking the nutrition label to see what that content is. And it has gotten easier to do. They changed the laws on nutrition labels this past year. And now there is a separate row for added sugars. So it's becoming a little easier for the average everyday person reading nutrition labels to figure out where that's coming from. Okay. Now, what we do want to do to help improve our blood sugars and our triglycerides is to eat foods that are digested more slowly and don't have as much effect on our blood sugar. So these would be things like non-starchy vegetables, those whole grain products that we were talking about just a little bit ago, fruit again, starchy vegetables with the skin on, and beans and legumes. So I don't know if anyone's noticing a pattern here when we talk about these foods. Again, many of them are plant-based, and these really good sources that we want to strive for are higher in fiber. And so fiber is a big key in helping us with our digestion, with helping us manage our cholesterol. And we know most people aren't hitting those goals. So this is a great area of opportunity to be able to include more of these kinds of foods throughout our day, not just at meals, but also at snacks. Okay. And then when we look at blood pressure, we're going to look at sodium as a big issue that most people are eating more than what the recommendations are at this point. The average American is eating more than 3,400 milligrams of sodium daily, which is more than 1,000 milligrams per day over the recommendations. The goal currently is to shoot for 2,300 milligrams or less per day, with an actual ideal limit of being 1,500. Certainly if you have, if you're older, or if you have any other type of existing conditions, shooting for that lower goal is ideal, but challenging. So I always encourage people, if this isn't something that you've been monitoring, or if you know you're in that group that's well above the 3,000 milligrams per day, initially maybe just shoot for the 2,300 and see if you can work on stair stepping your way down closer to that ideal goal. So foods that are very high in sodium that we hopefully could avoid would be most restaurant or takeout foods. Almost all of them are going to be much higher in sodium than even the same exact food that you might make at home. Processed meats like cold cuts, cured meats, any of like the salami, pepperoni, those kinds of things are all going to be very high in sodium. Cheese is another area that I think a lot of people don't realize. Cheeses and cottage cheese can be very high in sodium. Soups, I think that one's a little more obvious, and some of the instant foods like the frozen dinners or the ramen meals, those are all going to be very high in sodium. A lot of sauces and condiments that you buy at the store. And then of course, those salted snacks, everything from crackers to chips, even nuts often usually have salt added to them. So in many of our foods outside of the fresh produce and the fresh meat sections of the grocery store are having sodium added either for flavoring or as a preservative. So the less of these foods we eat, generally the better our sodium intake will be. Okay, and then what we want to work toward is eating foods that are higher and provide good sources of calcium, magnesium, and potassium. These minerals are often lacking in the standard American diet, but these can be helpful for our blood vessels to be reacting how they need to be, have the flexibility to be able to relax or constrict. And so many of the really good sources of these foods are, again, coming back to the plant-based foods. A lot of our vegetables and fruits can be great sources of potassium. Nuts for some magnesium, or low-fat dairy can be a great source of calcium. Also those dark leafy greens as well. So these are the types of foods we want to try to be working more of into our diet throughout the day. Okay, so knowing all of that, and I know that's kind of a lot coming at you, what we want to think about to wrap it up and say, okay, what should we be considering when we look at snacks? Ideally, we'll choose whole foods in their most natural form. As you guys have probably noticed so far, we would like a high intake of those plant-based foods to get that fiber intake in. Our goal would be to try to get to 3 grams per serving for a snack if we can. Focusing on those nutrient-rich foods that have those minerals that we need, the vitamins and minerals. Trying to limit our sodium to no more than 200 milligrams at a snack. And if you do have to purchase something packaged, try to look for products that are minimally processed. Look for the fewest ingredients you can get in whatever it is you're purchasing. So let's take a look at what this looks like specifically in some different foods. Okay. So I know with snacks, crunchy is a big thing for a lot of people. It's definitely a sensory thing that we like to have and to feel like we're just kind of crunching on something, and it's a satisfying experience in and of itself. So here are some examples of healthier versions of crunchy foods that we could work in as snacks. Fruit, apples and pears can be crunchy. And if you want to pair those with something with some protein, you could do a no added sugar peanut butter or almond butter, and that would make a pretty satisfying snack. Raw veggies. And I know a lot of people don't like to eat vegetables just by themselves. And so they feel like they can't because they know like a lot of the dips aren't great for them. But you could make your own dip with a non-fat or low-fat plain Greek yogurt. It tastes very much like sour cream if you haven't tried that, but it's going to be low in fat and high in protein. And then you just take your own favorite spices, something like a ranch packet, the dry packet, or Italian if you like that, or whatever spices you enjoy. and make up your own dip for your veggies. And that way you can have a guilt-free dip. And for a lot of people, that would help them eat more vegetables. Roasted chickpeas, those are kind of new as a snack. You can spice those, flavor those however you like, and then roast them in the oven. That makes a nice kind of crunchy, handy snack that you could throw in a bag and take with you. Popcorn the same, and popcorn is a whole grain. So if you take all the bad stuff that's added, like at the movie theater, take that away and maybe try to get it air popped and add your own seasonings. That can be a nice healthy snack. Nuts and seeds can be a nice crunchy snack. You can roast them for a little bit of a different flavor or add spices to them. Ideally, you'd want to buy the versions that did not have salt added to them. Or you could even make up batches of something like a Greek salad, where you have mixed vegetables like cucumber, tomato, red onion, feta, and just put those in small individual servings, and that could be a nice snack too. And then the last one we have here is a homemade trail mix, okay? And I will, as I'm talking about that, I'll advance that. Here's an example of a recipe that you could do for a homemade trail mix. Many of the store-bought versions can be very high in sugar because they're almost as much candy usually as they are the trail mix part. So in this recipe, you'll see it does have different nuts and seeds, a little bit of a dried fruit, and just a tiny little bit of like a dark chocolate chip, which is going to be lower in sugar, but and in a smaller amount than most of the pre-made trail mixes that you have. So something like this is going to be very satisfying. If you buy the unsalted versions, it's going to be low in sodium. It's going to be a great source of antioxidants. And it's going to be very satisfying and filling because it's also going to be a good source of protein and fiber. Okay. The next category of snacks that I put a few examples for was heartier snacks that would fill you up. So these would be something that would be great if you have a big gap between meals. So maybe, you have lunch at 11 or 12, but you don't get to eat dinner till 7 or 8 o'clock at night. So something mid-afternoon that's a little more hearty that wouldn't tide you over so your hunger doesn't get out of control. A few examples here: a whole or sprouted grain bread with a no sugar added peanut butter, hummus with vegetables or whole grain crackers, one of those lower sugar, lower fat yogurts, maybe with some berries on top, whole grain crackers with a low fat cheese, or even an English muffin. You can get those in whole grain or sprouted grain versions now as well. You could do a wide variety of toppings on that. This example I did just chopped tomatoes, oregano, and a little mozzarella cheese, kind of mimic a little mini pizza. It can make a nice snack. Tuna packs now are very easy and convenient to grab and take with you. Edamame is a soy product if you're not familiar with that, but you can get frozen edamame and just heat it up in the microwave, put a little seasoning on there that can make a nice crunchy snack, or even something like oatmeal, where it's going to be a great source of fiber. You can put a little cinnamon or some berries on there. And then lots and lots of opportunity when it comes to smoothies. So here I've put an example of one that could have both fruit and veggies in there. You certainly can look on the internet and find many recipes for smoothies. Ideally, I would encourage you to look for one that doesn't have too much added sugar, or to modify it. If you see a recipe that you like, but it has a whole lot of extra honey or other sugars added to it, maybe just cut back on those and try to minimize that as much as possible. Focus on things here like the berries and the spinach that are going to be very nutrient dense for us and be a great source of fiber. Between the berries and the banana, that gives it a little bit of sweetness, enough to taste. And that frozen banana gives it a nice creamy texture along with the avocado. Okay. So that's also going to be a snack that's going to be very filling because it's high in fiber. It's going to be low fat, healthy fats that are in there with the avocado and the seeds, low in sodium, and another great source of antioxidants. Okay. And then another thing that people tend to turn towards snacks for is if they're having a sweet craving. Many of the commercial snacks that are out there for that sweet craving are just completely full of added sugar and often that saturated fat as well. So here are a few alternatives of things that you could try that might be, still satisfying that sweet craving, but in a much healthier way. Frozen grapes are a great snack and something that's quick to, if you put it in a baggie and freeze it, it's quick to grab and go as you go out the door. Frozen banana, maybe dipped in a little bit of dark chocolate. That's a delicious treat. Or almonds dipped in dark chocolate. You can take strawberries and dip them in that plain Greek yogurt and freeze them, and that's kind of a nice treat. Fresh fruit salad topped with a low-fat vanilla yogurt. Those smoothies that you've made maybe earlier, you could freeze them and eat them like ice cream. Or take actual fruit like apples and pears and bake it, which helps caramelize the natural sugars that are within them. And or these homemade energy bites. Okay, so I've put a couple examples here with the simple baked apples. It's a very small amount of little bit of butter added just to help them soften, but compared to the quantity of apples, it's a pretty small amount with some cinnamon on top. Mixed together and baked, this can make what really tastes like a dessert, but is primarily just apples. Okay. So it's going to be a great source of fiber and again, antioxidants. The cinnamon helps throw a little bit of that on there as well. And then here's an example of what one of those energy bites might look like. This is another thing, kind of like the smoothies, where there are many, many recipes online for energy bites or energy balls. And I would just encourage you again to look overall at how much they're adding of higher or added sugar sources. This one does have a little bit of honey added to it, but when you look at the amount versus the total number of bites that this produces, it still keeps it at a pretty low level per bite. So we're gonna have great sources of fiber in here like oats, the flaxseed, getting some omega-3s as well from that. And again, it's gonna be a lower sodium snack and should be, again, very filling, something that's portable, you can make up in batches, keep in the fridge or the freezer and take with you as you go. Okay, so kind of as a wrap up, in summary, we're trying to work away from those animal-based fats more towards increasing our plant intake, our plant food intake, our whole grains, our fiber intake, decreasing that added sugar, and decreasing salt whenever we can. Okay, so I hope those ideas were helpful and healthy snacking. So that's the end of my presentation. I'll turn it back over to Nicole.
Great. Thank you, Kris. That was wonderful. I will quickly introduce our next wonderful presenter. She's our last one for the day. Here we have Lauren Schmitt. She attended Ohio University, where she achieved a Bachelor's of Science in Exercise Physiology, participated in a cardiopulmonary internship at Duke University, and holds a clinical exercise physiologist certification through the American College of Sports Medicine. Currently, Lauren is the team leader of cardiac rehabilitation and VO2 max stress lab at Ohio State Outpatient Care East. Lauren, take it away.
Awesome. Hey guys, sorry, I'll try to keep this brief. My presentation today is on getting active from home during COVID-19. I know, as Dr. Larry said, last year, we've been more accustomed to sitting on the couch and binge watching Netflix. So today I'm going to hopefully re-inspire you to get up off the couch and get moving. I want to go over some terminology real quickly first. Anaerobic training versus aerobic training. Aerobic exercise means with oxygen. So it's the metabolic pathway that requires oxygen to produce energy that a body needs to do a certain task or certain exercise. So examples of these aerobic exercises would be walking, running, cycling, swimming, all of your, more known as the cardio exercises. And then the anaerobic exercise means without oxygen. So it's the metabolic pathway that uses glucose to produce energy that a body needs to do an exercise. And this is more of that high intensity interval training that you can see, or resistance training, you know, doing sprints, some short, powerful bursts of exercise, something like that. It creates energy faster, but it's short-lived. So it produces that lactic acid, or that burning sensation that you feel when you first start working out. In order to see the best, the greatest weight loss and the most health benefits, is to do a combination of both the aerobic and anaerobic exercise. Okay, so the first thing I'm going to talk about is how to get active through a home gym. So some people are lucky enough to have treadmills, recumbent bikes, spin bikes, ellipticals, rowers, etc. So those are great. Do them for about 30 to 45 minutes, 3 to 7 days per week. If you have dumbbells at home, resistance bands, bench presses, all that's great. If you don't know where to start, say you have all this stuff, but you're like, I don't even know where to even begin to use them. On OSU's One Source under patient education, there are all kinds of patient handouts and exercise handouts that show pictures and give you step-by-step instructions on how to use that. You just need to type in that search bar strength training, and a bunch of resources will come up. You can give to your patients, or you can use for yourself, all that good stuff. Also, ways for you to hold yourself accountable. Schedule out your workout days each day, each week, each month, etc. So put it on a schedule somewhere where you can see it, like in your phone, or if you have a big calendar. I have a big calendar on my refrigerator that you can write in your scheduled times. If you schedule it, then you're more likely to do it. And if it's staring you right there in the face as you're opening the fridge to get another snack, maybe you'll be more inspired to go downstairs, or, you know, go in your gym and hit some weights or something. Set an alarm in your phone so you don't forget, or if it helps motivate you to get off the couch or wrap up your work. I know sometimes a lot of people are working from home now, and you get caught up in work and it's 6 o'clock and you completely forgot to work out, and you still have to make dinner and pick up the kids and all that stuff. So if you set an alarm, that way it's a reminder for you to get up, get moving, and it'll keep you accountable. You can get a workout buddy. Of course, it should be someone in your COVID bubble. So maybe it's your spouse or one of your kids, or someone you see very, very often, that keeps you accountable and keeps you going. If you don't have a home gym, you can exercise outside as the weather's starting to get nicer. You know, obviously last week with 12 degrees, we really don't want you exercising outside, but now it's getting warmer in the springtime. You can go outside in your neighborhood and do some laps around the block. You can go to a park, meet a friend. You can even shoot some hoops with your kids or grandkids. Get out there, kick a soccer ball, throw a baseball. Like I said before, just be aware of the weather. You know, if it's projected we get a lot of storms in the upcoming months in the spring, we definitely don't want you walking out in that. If it goes back to, hopefully not, being bitterly cold, we don't want you walking when it's very, very cold. That could be bad for cardiovascular, especially people who have known heart disease. If you do go outside and it's cold, we want you to, of course, wear your mask. And that will help filter in some warm air as well. And again, if you're doing this in the summertime, make sure that you're going out not at the peak heat of the day, but try to go out more in the mornings and evening time. Next thing, if you don't have, again, a home gym, you can look up YouTube videos. This is a great resource for people to work out. I know I use it pretty much every day to find good videos to work out. You can use this FIT acronym to help specify what kind of workout you're looking for. So FIT stands for frequency. If you want to follow a program that progresses over weeks or months. Intensity, include keywords like beginner or advanced, depending on how intense you need or want that day. Time, it can include 30 minutes in your search, to specify how long. So say you only have 15 minutes, search 15-minute workouts and you got a quick one just like that, and type. This is important if you want something high intensity, or if you're looking more for like yoga, Pilates, chair workout, body workout, etc. So I put an example down there to search in the YouTube 12-week beginner body weight 30-minute workout. So it'll come up with a bunch of different workouts that you can select from and participate in. If you are elderly, or you're just, I should say, seasoned, and you're not so much into these higher intensity workouts, there are still some things available for you. Yoga is a great workout. You still strengthen core and tone all your muscles. It helps with breathing and stress, which we learned about earlier, which is a huge risk factor with cardiovascular disease. Pilates, same thing. You'll get a great workout doing Pilates, or you can do chair workouts as well. So it'd be squats and hip abductions and all, dips and all that stuff that will still get you a really good workout. And again, you can find all these different types of workouts on YouTube or apps on your smart TV and on your smartphones. Social media is blown up with exercising videos and fit tips and all that stuff. If you are, accustomed to using Instagram, Twitter, Facebook, a lot of podcasts will talk about good exercises you can do. I listen to podcasts that good exercises to help stretch back and hamstrings and all that stuff. So it doesn't just have to be about working out. It could be stretching and warming up and all that stuff too. You can use your household items. If you don't have any dumbbells, resistance bands, anything like that, climbing a set of stairs in the house or in your apartment complex is probably one of the best exercises you can do. It really ramps up that cardiovascular fitness level. If you have jugs of milk or water or canned goods, they can replace dumbbells. You can use laundry baskets full of clothes for squats or rows. Anything you can find in your house that's heavier. Kitchen chair, like I mentioned before, the chair workouts, you can do dips, squats, hip abductions. If you have a rope, jumping rope is a great exercise. Deep cleaning your house. Sometimes, especially, if we've let it get a little messy over the winter time, we can do a nice, good deep clean for the spring. Gardening, especially in the spring, is very, very taxing on the body. So we can do body weight exercises such as push-ups, squats, burpees, lunges, planks, etc. All that will get you a phenomenal workout. Get that heart rate up. I think that is all I have for you guys. Unless you have any questions, I will send it back over to Nicole.
That was great, Lauren. Thank you so much. A lot of useful tips and stuff that I know I've definitely tried to adopt, especially with the YouTube workout videos when gyms were closed. That was very popular. Absolutely. So I see we are just about at the time. We have quite a few questions that came in throughout the presentation. So if our three speakers have the capacity, I could send the questions we don't get to right now to them to type up some short responses, and I can send those out in our follow-up email. But we can try to knock out a couple of these. All right. Our first question, which this might be for Dr. Larry, someone is wondering what may cause a recently elevated heart rate between 70 and 95 when they never had this problem before, and are there ways to bring it down?
Yeah, so normal heart rate would run anywhere between 55 to 60 up to 100. So that's still normal. Your heart rate's governed by what's called the autonomic nervous system, sort of the nervous system that you don't have to think about. Certainly, being more conditioned, so more physically fit, would cause more parasympathetic impact and slow heart rate. So it may just be a marker of being less active over the COVID environment. Nothing dangerous, but certainly regular physical activity with all the tips that Lauren shared can certainly help bring that heart rate lower.
Okay, great, thank you. And we'll just do one more. I'll pick one question for each of you. Anyone can chime in. For Kris, this one came up and there were a lot of comments in the chat about it. Do you recommend a specific brand of yogurt that has less sugar?
Well, that's a hard thing just because of taste. You know, so many people, taste is a pretty subjective thing. The biggest, many of the yogurts that say light on them are reduced in added sugar. Anything that says plain won't have any added sugar. And you'll find versions of that in both regular and Greek yogurts. But the easiest way is just to turn it around and take a look at that label and try to get that added sugar number under 10 grams ideally, but as low as possible of what you can find. But you know, there's many different brands out there, and unfortunately taste is just kind of a big part of that issue. So, you know, maybe just sampling a few different ones and seeing which of the light yogurts that you prefer.
Okay, that was great. And now for Lauren, this one came up during your presentation. You briefly touched on it. What exercise recommendations would you have for someone who gets out of breath easily and increased fatigue since having COVID?
Yeah, that's actually a big question we're having with our patients in cardiac rehab. The shortness of breath with COVID is something new that we're still kind of figuring out because it's very subjective. Some people could have a lot of shortness of breath, some people couldn't. I would say all those exercises are good. I would start slow though. So if you're, for example, walking on the treadmill and getting short of breath at 2.5 miles an hour, it's better to be able to exercise for a longer period of time than try to do as fast as you can and only do 5 minutes. So I would say instead, find what your threshold is where you're starting to feel short of breath and slow it down from there to enable to get that 15, 20, 30 minutes of exercise instead.
That's great. Great recommendation. All right, since we are over time, if we still have a couple more questions, if the three of you are able, I can email them to you. You can type up some quick responses and then I can shoot them out to all participants in a follow-up email.
Sure.
Yeah,
Yeah.
sounds
Great.
good.
Happy to.
Thank you all so much. Thank you, you three, for taking time to come present to all of us on a very important topic and giving us all useful tips and tricks to help improve our heart health. And thank you to all of you who joined us today. I hope you all learned something. I know I sure did. I will be sending out the responses in a follow-up email, as well as the slides will be in there, and an evaluation. If you could take a couple minutes to fill it out, it helps us better our future programming. So thank you, everyone. I really appreciate it. Have a great rest of your day and a great weekend.
Thank you.
Thanks.
Thank you.